What are the ethics of genetic testing for CF family planning? Genetic testing for cystic fibrosis in family planning is a complex topic that involves balancing personal choices, medical facts, and ethical principles. It's about helping individuals and couples make informed decisions about having children while respecting their values and rights. The main goal is to provide clear, accurate information so they can choose what's best for their future family without feeling pressured or coerced. The core principle of ethical genetic testing is informed consent. People must understand what the test can tell them, its limitations, and how results might influence their decisions. Genetic counseling is essential here. Counselors explain how cystic fibrosis is inherited, what it means to be a carrier, and what options are available. These options include assisted reproductive techniques like pre-implantation genetic diagnosis, using donor sperm or eggs, or choosing to adopt. It's important that individuals feel free to accept or decline testing without feeling forced. There is also a tension between reproductive autonomy and prevention. Many support carrier screening because it helps people understand their risks. Over 80% of cystic fibrosis patients and their parents favor preconception screening. However, some worry that screening might be used to discourage having children with cystic fibrosis, which raises ethical questions about coercion and personal choice. Medical organizations emphasize that screening should aim to inform, not to prevent, reproduction. Healthcare providers must share information without steering decisions, respecting each person's values and life goals. Timing of testing is another important factor. Preconception screening offers the widest range of options, including choosing embryos without cystic fibrosis, using donor gametes, or adopting. Prenatal screening, on the other hand, often leads to decisions about pregnancy continuation or termination if the fetus is affected. Offering carrier testing during pregnancy can be ethically sensitive because it might blur the lines between routine prenatal care and genetic diagnosis aimed at pregnancy termination. Clear communication is vital so that individuals understand the purpose of each test. People with cystic fibrosis themselves have diverse views on passing the condition to their children. Some worry about their future children having cystic fibrosis, while others choose to have children regardless of the risks. Respecting these different perspectives is part of ethical practice. It's also crucial to communicate the limitations of testing. For example, carrier screening panels are about 80% sensitive, meaning some carriers might be missed, and false reassurance can occur. Patients should be aware of these limits and potential psychological impacts, such as discovering unexpected information like misattributed paternity. Equity is another key issue. Carrier screening should be accessible to all, regardless of ethnicity or socioeconomic status. While some populations have higher risks or specific variants, offering testing only to certain groups can create disparities. Universal screening programs aim to provide equal opportunities for everyone to learn about their genetic risks, but they must be implemented with proper counseling and privacy protections. Genetic counseling plays a vital role in ensuring ethical standards are met. Counselors help individuals understand inheritance patterns, discuss family building options, and clarify their values. Good counseling can improve knowledge and help people make decisions aligned with their beliefs and circumstances. It also helps balance the benefits of genetic information with the potential emotional or psychological burden it might carry. Finally, ongoing ethical challenges include managing the psychological impact of testing, especially when results are uncertain or incomplete. False positives or unexpected findings can cause distress, so providers must communicate carefully. The goal is to empower individuals with knowledge while supporting their emotional well-being. Professional guidelines stress that genetic testing and counseling are parts of comprehensive reproductive health care, not replacements for other medical or screening services. Looking ahead, integrating high-quality genetic counseling into cystic fibrosis care teams is essential. This approach respects individual differences and supports informed, autonomous choices. Ultimately, the ethics of genetic testing for cystic fibrosis in family planning revolve around respecting personal values, providing accurate information, and ensuring equitable access, all while supporting individuals in making decisions that are right for them. Always remember to consult healthcare professionals for personalized advice, as each person's situation is unique.